surgical services. Our rehab program at Oak Forest Hospital has a great reputation. And then we have a very large diabetic population, and we feel that there's an opportunity with the services that we provide and our expertise to really do more in terms of extending diabetes care and education across the county through our diabetic patient population. Another recommendation in the plan is that we recognize that we can't meet all of the needs of the population of the county by ourselves, and that we should be looking at opportunities to develop partnerships with other providers, both hospitals, medical centers, clinics located throughout the county. There seems to be a lot of interest in doing that. We spent a lot of time in strategic meetings with other partners. But we've also heard at meetings like this a lot of skepticism about those partnerships, that the partnerships that the county has had over the years are not always necessarily beneficial to our system and our patients. And I would just say and commit to everybody that we're not going to pursue partnerships unless it's mutually beneficial, and most importantly, that it's a benefit to our patients. So we would be considering these partnerships very carefully. The third goal in the plan relates to the realignment of services. And what we're looking at here is the services that we provide on all three of our hospital campuses at Providence, Oak Forest, and Strozier. And one of the changes that we've made in this plan, in the initial draft of the plan, there was a recommendation that we consider or study the development of these regional outpatient centers or regional hubs at the Providence and Oak Forest campuses, and that we consider and study discontinuing inpatient acute care at those locations. And I think as we've looked at this plan more, as we've gotten more input from people, we've recognized that we need to make sure that our patients are receiving appropriate care, and we're not just going to cut off inpatient services if our patients don't have an alternative. And we've heard a lot about the need for inpatient care at Providence in this area. We have a very active emergency room at Providence. There's a real concern that if we don't have an inpatient hospital with an emergency room, then we're really not meeting our mission of caring for our patient population. So we're taking a step back and we're re-looking at that. We're looking at what would it take to have to continue to have inpatient services, emergency room at Providence. There have been discussions with the University of Chicago about developing a stronger relationship at Providence. So there's much more work that we're going to be doing on that. And the same at Oak Forest. We certainly have gotten a lot of feedback about both inpatient needs and emergency needs of patients in the southwestern suburbs. At Oak Forest, we do have inpatient rehab and outpatient rehab, a long-term ventilator-dependent unit. Those are all services that are really important and necessary. But we're also going to be looking at the inpatient acute care and studying that further at Oak Forest, because at Oak Forest, it's even as everybody appreciates, it's even longer for patients to come to travel to Strozier, and that's a major concern and a major issue. But what we would want to look at in this plan, as we look at this regional, hub or regional outpatient center concept, is to look at initially placing those at Provident, at Oak Forest. On the Strozier campus, we have two major capital needs having to do with accessibility, parking. We're in dire need of parking at Strozier. When the parking garage was built, there was a plan for phase 2 of that garage that hasn't happened yet. And we feel that we really need to be able to move forward because it's only fair for people, for our patients, to provide them parking. It's a major issue there. And then the second is to rebuild the Fannis Clinic. Now the Fannis Clinic, with this regional hub concept, we may not have as many patients having to come to Fannis for care as we become more accessible at these regional hubs. But we still recognize that the Fannis Clinic, there's a high demand for services there, and we really need to replace, upgrade, not just upgrade, but replace the building. So as we move forward with the plan, the other major goal that I think all of us believe we've got to address under any strategic plan if we're going to be successful and meet our mission as the county healthcare system is a commitment to quality, patient safety, patient satisfaction, and also recognizing the growing cultural diversity of our patient population. And we need to be able to relate better to our patient population, and we need to invest in all of these areas, in quality, patient safety, and cultural competence. And that's another major recommendation of this plan. And then finally, staff development. We've not invested enough in terms of the development, education of our staff, our employees. So we're recommending that we really focus on that as well as we move forward and try to better and improve this organization and this health system. So to conclude, again, the themes that we're trying to address in this plan are that we want to be convenient, caring, comprehensive in terms of our services that we provide, responsive to our patients, with a focus on high quality. So that's the overview of the plan. I just want to reiterate that this plan, number one, is far from done. This is an important part of the process to get input from people. We're going to be discussing this next week at our board meeting, but I'm going to be recommending that we slow down this process to allow us more time to engage various parties within our health system and the county so that we can explore some of these outstanding issues that are still really out there in terms of the inpatient services at the other hospitals. Where exactly would we locate these hubs? It's one thing to say, well, we're going to have hubs, strategically located, but much more study on, where these hubs would be located. And then the other big part is when we talk about partnering, it sounds nice, but what are the kinds of partners that we're going to work with? As Chairman Bass indicated, this concept of these regional advisory boards, we feel would really be a great help to us as we further pursue this plan, to really be able to get input from people in the local community, because I think everybody up here would admit that our board isn't representative of all of the communities that we serve in Cook County, and the various communities are different in terms of what their healthcare needs are. So that's another thing that we want to look at as we move forward with this plan, is to establish these regional advisory boards and get their input on the planning as well. So that concludes my comments, and the rest of the evening, it's open for questions, or I think more importantly, we'd really like to get your feedback and your thoughts on this. And we won't necessarily be responding to every person that gets up, otherwise everybody won't have a chance, but there will be time towards the end where I would like to sort of summarize what we've heard and what we intend to do to address what we hear. I think, are you going to introduce Director Munoz? Did you?